Welcome to the benefits of quitting tobacco. In this presentation, we will explore the health and financial benefits of quitting tobacco. Today, you will become aware of why it is so difficult to quit and learn effective strategies for making lasting changes to successfully quit tobacco and improve your health. Let's begin by looking at some tobacco statistics. Were you aware that 80% of adult smokers began smoking before they were 18 years old? 70% of smokers say they want to quit, and each year 41% make a quit attempt of at least 24 hours. Without some sort of assistance, only about 5% of those who try to quit will remain quit for at least 1 year. For those who use smokeless tobacco, compared to the 1 to 2 milligrams of nicotine in a cigarette, the average chew of tobacco contains 4.5 milligrams of nicotine, and snuff tobacco has about 3.6 milligrams per pouch. A person who dips 2 cans a week receives the same amount of nicotine as a person who smokes 1.5 packs per day. Individuals who have smoked and also dipped or chewed tobacco often say they find it more difficult to quit chewing or dipping than they did to quit smoking. Given this information, you can see why it is important to receive support during your quit process. Have you ever wondered why quitting is so difficult? If you've tried to quit before, or even many times before, you are not alone. It takes more than just willpower to quit tobacco. When you take a drag off a cigarette or use smokeless tobacco, nicotine reaches your brain within 10 seconds. Nicotine stimulates the release of a chemical in the brain called dopamine. Dopamine produces sensations of pleasure and calm. However, when you're not using tobacco, dopamine levels decrease and your body begins to crave more. If you do not receive more nicotine, you may begin to experience increased feelings of discomfort, like feeling irritable, a headache, or not being able to concentrate. These feelings are actually physical withdrawal symptoms. Behavior can be hard to change, especially when it has produced a predictable pattern of enjoyment or perceived benefit in your life. These are called triggers. Think about using tobacco when you drive, with your morning coffee, while hanging out with friends, when you feel stress, or during an enjoyable activity like watching sports, a cookout, or other social gathering. Using tobacco while engaging in these activities can be comforting. Tobacco use can also create a sense of belonging with other tobacco users. This can make quitting especially difficult for those who have a spouse, partner, or other household member who uses tobacco. Now let's look at the benefits of quitting tobacco. Did you know your body begins to heal from the moment you quit using tobacco? Within 24 hours of quitting, your risk of having a heart attack decreases, your blood pressure drops, and excess carbon monoxide leaves your body. In as few as 2 weeks after quitting, your blood circulation and lung function improves. In 1 to 9 months after quitting smoking, coughing and shortness of breath decrease, and your risk of respiratory infection is reduced. In only 1 year after quitting tobacco, your excess risk of coronary heart disease is half the risk of when you smoked. The health benefits continue the longer you stay quit. 5 years after quitting tobacco, your risk of having a stroke is reduced to the risk of a never smoker. 10 years after quitting, you have reduced your risk of lung cancer. And finally, 15 years after quitting, your risk of death from disease is the same as for a never smoker. There are many other benefits that come with quitting smoking. Next to improved health, financial savings is the biggest reason for wanting to quit. If you smoke 1 pack of cigarettes a day at an average cost of $5.71, you will have a savings of $2,084 in 1 year. 5 years after quitting, you will have saved more than $10,000. For smokeless tobacco users, your 5-year savings is about $7,000. There are other financial savings associated with quitting tobacco, such as lower health insurance premiums and fewer doctor visits for tobacco-related illnesses. Can you think of some things you would like to do with this extra money? More time is another benefit of quitting tobacco. It takes about 6 minutes to smoke a cigarette. If you smoke 1 pack of cigarettes per day and quit, you get back 720 hours in 1 year. That's 30 days. Think about what you could do with all of that extra time. Think about these additional benefits associated with quitting tobacco. Your sense of smell and taste improves, so food is more enjoyable. Your breath, hair, and clothes no longer smell like smoke. Your teeth and fingernails are whiter and your skin looks healthier. When you quit tobacco, you may experience some withdrawal symptoms and a wide range of emotions over the first days and weeks after quitting. Talk to your health coach about coping skills to help you manage this time. Speak to your provider about tobacco treatment medication that can help ease withdrawal symptoms and cravings. On the positive side, you will likely experience an increase in energy and be able to breathe easier. This would be a good time to talk to your health coach about increasing your physical activity, as this will help improve mood, offset cravings and withdrawal symptoms, as well as limit potential weight gain. Other potential positive physical effects of quitting are a decrease in your nagging cough, improved sense of taste and smell, and improvement in your skin color. You may also feel pride in your accomplishment and a sense of relief at no longer being controlled by tobacco. Having an idea of what to expect will help you plan strategies to cope with withdrawal and stressful situations without tobacco, as well as help you focus on the benefits you will receive from quitting. So what's next if you are ready to quit? First, believe you can quit. We believe you can, and you need to believe it for yourself. Did you know that more than half of all adults who report being a smoker in the past have quit? They did it, and so can you. Next, know that Care Here is here to support you throughout your quit process. Be sure to speak to your Care Here provider and receive a referral to a Care Here health coach. Your health coach will provide ongoing support and encouragement for as long as you need it. They will also provide you with strategies and coping skills to help you manage withdrawal, cravings, triggers, and stress. Your health coach will discuss different tobacco cessation program options that are available to you through Care Here, whether it is a group workshop, an online program, or telephonic coaching sessions. They will help you decide what works best for you. Be sure to speak to your provider about tobacco treatment medications that are available at your health center at no cost to you. Your provider can help you decide which medication is right for you. Combined with coaching support, medication can more than double your chances at a successful quit attempt and help ease withdrawal symptoms. It's never too soon or too late to quit, and Care Here can help. Contact us by emailing wellness@carehere.com or calling 877-423-1330.